Greetings, this is Dr. Matthew Korn, 65 Plus Center for Active Aging, here with your weekly rounds video cast. As you can see, I have my face mask on just to show as an example. They don't have to be confining, they don't have to be uncomfortable. This is a tie behind, so there's a tie behind my neck and my top of my head. And I've been wearing it in and out of some stores today, and now I'm back at my office. You can see it's Friday, April 24th. I'll remove the mask now. And there I am. So today was a productive week on many fronts for us. Continued to see an increase in telehealth visits, so that's excellent. Also, been talking more and more to patients and seeing where they're at with things, and most people are kind of adjusting to a change in lifestyle and kind of getting used to doing things in a slightly different way. Um, Unfortunately, if you're not, you don't access the internet, you don't use a computer or smartphone, um, it makes it more challenging. I think it's a good excuse for you to start playing around with that. Personally, I think smartphones and tablets are a little easier to manage for the layperson than, say, a computer. A lot more steps to making sure a computer is working well, and it's just more intimidating. So maybe a good opportunity to treat yourself to a tablet. There are a lot of online, like YouTube type videos that can teach you how to use it. Um, I am not a user of Apple products, but I know they have a service called Genius, and I think somebody can help you online and over the phone acclimate to using their products. Um, and I know my dad uses that a lot to help him deal with his various technological challenges. So that's just throwing that out there. Um, the president today signed a new law extending some stimulus for businesses and hospitals to help them with the crisis. You can imagine my business has been closed 5 weeks now. We're impacted. We did apply for some funding through the various programs. Nothing yet, but that was encouraging that they got some more stimulus money flowing there. I read somewhere that on average, a hospital loses $6,000 a patient that they're treating for coronavirus, and my presumption is that is even with insurance because of the high cost of care. So I think that stimulus bill was designed to help some of the hospitals because obviously if they can't operate, then they're not going to be able to help any of us. And then I believe some of that stimulus money is also being driven into testing products, PPE, personal protective equipment, masks, swabs, all those things. Another thing that was interesting, I don't know how you manage your finances, but there used to be a limit on how much you can draw from a savings account. Um, you could draw 6 times a month. The Federal Reserve has eliminated that restriction, so you can withdraw as often as you like from your savings accounts. For us personally, we keep money in emergency savings, and obviously we tend to spend money that we see in our regular checking account. So this is nice because we can only transfer what we need at that time rather than making larger transfers in anticipation of costs that we may or may not have. So that's a nice feature. Make sure you don't get charged a fee or be restricted by that from your bank if that's what you're doing. Um, I am in the process of getting COVID testing. I actually, because I'm a healthcare provider, I was finally called and I'll be getting a swab test for the active virus next Tuesday. So what essentially that looks like, it's a very large Q-tip and it's going to go up the nose and back in the back of the sinuses where the virus tends to live. And that will tell me whether I have um, the virus is active and alive in my system. I don't have any symptoms. I could have carried it. I could have had it and never had a symptom. So I doubt that's going to be positive without any symptoms, but you just never know with your daily interaction. And I also have a private test set up that I'm paying for. It's an antibody test. It's a serology test, which means they're going to draw blood and they're going to send it to a lab, and the lab is going to look for certain antibodies. And what that would do is that would say if I've ever had it, even if I don't have an active virus now, has my body produced antibodies to protect my body from um, uh, future assaults by the virus. Well, that's good for me because if I have antibodies, I'm protected. It's also good for my patients because um, I likely will not be a carrier and I therefore cannot pass it on to you. Um, and of course, I'll share that information with all my patients. Another thing that I'm going to get into briefly is we're working on a phased reopening plan, and we've come up with phase one, and that's going to start May 4th. I don't want to go into too much details here because there's quite a bit that goes into it from a scheduling standpoint, from a safety standpoint. Unfortunately, some patients are going to be excluded from coming back due to, you know, some concerns I have given their situation. But for the most part, we're going to be doing some one-on-one care with no one else in the building. And if you please, if you haven't subscribed to my newsletter, please do so, and then you'll get the full information. Of course, you can also call my office Monday through Thursday, um, 9 a.m. to 12 p.m. for next week. We're going to expand our hours the first full week of May, and you can talk to somebody, or if you leave a message either on our website or the phone, we'll call you back. And then I want to dedicate the rest of today's session, because I only have about 3 more minutes, into my topic of the day, which is dizziness. Now, dizziness is it's an umbrella term. You can be dizzy for lots of reasons. What I'm going to focus on is dizziness under the dizziness umbrella is vertigo. Now, a lot of people use the word vertigo inappropriately. The best way I can describe vertigo is more of a sensation that stationary objects are moving even when you're not. So almost kind of like if you were to spin yourself in a circle. I don't know if you did that when you were a kid. Spin yourself in a circle a bunch of times and then you stop and then everything around you is moving. That is a temporary um, vertigo that is caused by the centrifugal force of your vestibular system being put in motion. So your vestibular system, you have one on each side, is an organ kind of, it's not part of the ears or the auditory system, but it's kind of behind the ears. So we tend to refer to it as the inner ear, but that's not very accurate. It's an organ that basically helps your body with your brain understand where your position is in space relative to the world around you. And as you age, that organ can become less reactive to those motions. A lot of things can impact that as well. Um, Long-term antibiotic use or frequent antibiotic use, Meniere's disease, which I think you probably heard of at some point in time, even though very small cases of people with vertigo have Meniere's disease. As a matter of fact, it's often been misdiagnosed for older patients. So if you were once diagnosed with Meniere's disease, I would have that rechecked by an otolaryngologist. An otolaryngologist is also known as an ENT or ear, nose, and throat doctor. And we're lucky to have a pretty good choice of ENTs in the area here. But physical therapists are actually one of the best people to help you get over your vertigo when it's what we call benign paroxysmal positional vertigo, or BPPV. Again, there are many types of vertigo, just like there's many types of dizziness. But if you've been diagnosed with BPPV, or you're not sure, a physical therapist is one of the clinicians that can help establish that diagnosis, although I would defer it to an ENT who does that more frequently and has more tools at his or her disposal to definitively diagnose that. But if you do have BPPV, which again happens about 90% of the cases, a physical therapist is the first place you should go for treatment, because there are treatments we can do that can minimize the extent of your symptoms or eliminate the condition altogether. If you've never had it, what happens beyond the sensation that things around you are moving is you have a feeling of nausea. You kind of go into a panic attack because it's almost like you're moving but you're not moving, and you have the sensation that you're falling. And people often hurt themselves trying to prevent themselves from falling even when they're not. So it's something that we can treat pretty effectively. The first thing that we would do is test to see which side is affected and which canal, you have three canals on either side, is affected. And then treat that accordingly with what we call an Epley's maneuver. And an Epley's maneuver allows us to reestablish where the crystals, we call them autoconia, but we can also, the layperson, we call them crystals. We need to reposition them into a place where they're supposed to be, and that'll eliminate the dizziness. There's also some home exercises you need to do because your visual system helps to overcorrect for a vestibular issue. So doing eye exercises helps to correct some of the overcompensation that's occurring and feeding into this perpetual problem. There's also positionally things that you don't want to do. I always have this saying to my patients I'm treating with vertigo: you want to say no to vertigo. You never want to say yes, because that up and down motion tends to trigger the vertigo. The same would go for when you lay down and when you're getting up. You really don't want to lay flat if you're having active vertigo, and you also want to be careful about quick turns or moving your head too quickly. And those are things we'd educate you on and give you some homework assignments for. So dizziness, a component of dizziness under the umbrella of dizziness is vertigo. The things, the type of vertigo that physical therapists treat is BPPV, or benign paroxysmal positional vertigo, which is, when it is vertigo, 90% of the time it's BPPV. So we have a pretty good success rate, and we can help you with that. There are some medications that can help with but there's a lot of side effects that come with it. And oftentimes I see patients coming in my office complaining more of the side effects of medication than the dizziness itself. So something to think about on your Friday rounds. Again, our newsletters come out on Saturdays weekly, so you'll want to tune into that for more details on our Phase 1 reopening. This is Dr. Matthew Korn, Center for Active Aging, with your weekly rounds. Thank you for watching, and we'll see you next time.